Leukorrhea is one of the banes of girls and women. It is very frequent, like 50 to 75% of all women suffer with it in a greater or lesser degree. In some cases it is only an annoyance, necessitating the frequent changing of diapers, but in others it causes a great deal of weakness, backache, erosion, itching and burning. It is very resistant to treatment, particularly in girls. The reason it is so resistant to treatment is because the discharge, while coming from the vagina, it originates in the neck of the womb, and the several amounts of injections that women took for their leukorrhea only reach the vagina, they cannot penetrate into the womb. And it is only by treating the cavity of the cervix, which can only be done by a physician, through a speculum, that the root of the disease can be reached. If any erosion or ulcer is noticed, it can be directly touched up with the necessary application. And it is for this reason that leukorrhea in girls is so much more difficult to treat. For fear of having the hymen ruptured, the girl objects to a thorough examination and to local treatment, and the leukorrhea is permitted to proceed until perhaps with a chronic inflammation of the womb and the fallopian tubes is established. There is no doubt that many cases of sterility or childlessness in women are due to the long neglected leukorrhea in girlhood. The cause of leukorrhea is catarrh in any part of the female genital tract. The causes of catarrh are many, but the most common cause is cold. Wetting the feet and getting chilled, particularly during the menses, may set up a catarrh in the cervix. Long standing on one's feet, lifting and carrying heavy bundles, dancing in overheated rooms and then going out scantily clad in the chill night air, prolonged UN-gratified sexual excitement, lack of cleanliness in the external genitals, all these are the factors in setting up a catarrh of the cervix with a resultant of leukorrhea. A general rundown condition, worry, overwork, too hard study, lack of fresh air, and a general scrofulous condition also favor the development of catarrh of the womb and leukorrhea. The general treatment consists in general hygienic measures and in common sense. The patient should not be on her feet more than she can help, and she should not walk until exhausted or fatigued. It is better to take several short walks than long one. The corset she wears should be of the modern kind, not one that presses the womb and the other abdominal organs down, but one that supports the abdominal walls, and rather raises the abdominal organs up. The lacing or buttoning must be from below up, and not from above down. That is, should not in any way interfere with the freedom of respiration. Constipation, if any, to be treated, and must be treated intelligently, by mild measures, and care must be taken that the bowels is move at regular hours. Where the leukorrhea is due to or is aggravated by anemia and general weakness, a good iron preparation such as a tonic of iron, quinine and strychnine, will be good. A daily cold bath or cold sponge, and followed by a brisk dry rubbing with a rough towel, will also be useful.